Make a difference.
Wherever we want to. Humankind has that capacity today. So if money can be available, if technology is available, and if we can communicate, for goodness sake, why these millions are dying? That's why we are sitting here.
It's extremely important health workforce. We're not talking just about the 4 million or 4.3 million workers that are needed, but about how to retain them, how to pay them, how to make them be there when we need them. Funding gaps and constraints of delivering and scaling up support for the health system. But health systems is not really just for health systems, it's for results, for outcomes. To have less mothers dying, less children dying, less adults dying, less people dying from preventable diseases. It's really not just about the health systems, it's innovative funding mechanisms. What are the ideas out there? What kind of existing innovative funding mechanisms are there? What kind of new ones could be brought up?
Is because there's no money to pay them salaries and there's no way to ensure that this will be sustained over a long period. So as a result, you have a lot of people who just don't have access to healthcare because there's no human resources.
All this effort that we're involved in, it's not, we can't end up at the end of the day with relatively small amounts of money. We have to be ambitious. We have to be talking about raising large amounts of resources.
Every year we meet and we talk and we say, it's 10 million children who are dying. It's 5 million women who are dying. We have been saying this and we failed to produce the millions which were needed to save lives. It's a moral dilemma in which we are, which raised the issue of how worth a human life is. How worth a human life is. And how we can put up with our own consciousness. We sleep peacefully, knowing that I could have made a difference to save those lives.